They say that when you are in that area of the heart, working on those arteries, that's where your soul lives.
I was trying to get up and lost my balance. I fell over, and obviously by that time I knew something was severely wrong, and called for my daughter.
And they said, "We think you're having a heart attack," and I'm 48 years old. Of course I wasn't having a heart attack. I'm in perfect health. You know, I don't eat meat. I'm a vegetarian.
And he was doing really well. He ran almost the entire race and got just short of the finish line and collapsed. As soon as it happened, I ran back to him and felt for a pulse, and he wasn't breathing.
My daughter had signed up for the Shamrock Shuffle, so she recommended it, so I signed up for it as well. The thing for me is, you know, I'd always considered myself a healthy person, and I worked to do these things, and I didn't consider myself that old, and you know, it can kind of come out of nowhere.
From the time that it happened to the time they got him in the cath lab was just less than a half an hour.
The emergency room called me as soon as they heard. We met him at the door, we took him to the cath lab, and he was having a large anterior wall myocardial infarction in the absence of risk factors.
I didn't remember the 5K, I didn't remember anything. I had no clue why I was suddenly in the hospital.
And he's doing great, and his ventricle is normal, and he's going to survive, not only survive, but he's going to survive without congestive heart failure.
The pain in my chest would get worse every time I'd walk anywhere, and the arm, it started getting a lot worse. And so I have a friend of mine who noticed that things weren't quite right.
By looking at Tara, you'd say she's the picture of health. She still looks the picture of health.
They called an ambulance, but I didn't want to go to the hospital there in Ottawa. I wanted to come up here to Lawrence, where my doctor is, because I trust this hospital.
But she actually did the right thing. She brought herself to the emergency room.
And I was rushed right into the emergency room and had Dr. Dreiling right up in my face telling me everything was going to be okay, that he did this all the time and that I would be fine. So I knew it then that I was going to be fine. And they rushed me down to the cath lab and gave me 2 stents, and I was up in the room within just an hour or so, feeling a lot better.
Well, I treat my patients, I treat my patients like I would treat my family, and I use that actually as a judgmental tool. In other words, should this procedure be done, yes or no? And if I think the answer is yes, then I always ask myself in the back of my mind, if this were my wife, would I do this? If this were my son, would I do this? If this were my dad, would I want this done?
After they wheeled me back, he came in and he said, I'm going to tell you straight up, because I wanted to go home. And I said, I'm going to tell you straight up. I said, if you were my brother, this is what I tell my brother. So I'm not going to treat you any different than I would my brother, but this is what you need to do. And again, this is just their personality. I mean, for him to kind of sort of include me like I was his brother for those few hours, which was unbelievable.
And my job isn't to do what's easiest for the patient. My job is to do what's safest for the patient.
They rush you in the hospital, and really, literally, from the very word go, the lady that checked me and the very first person I saw, it was just unbelievable how quickly they got me in, and everybody was really gentle and kind.
The hospital was awesome. The hospital was just on top of what needed to be done and what to do, and just having him in the cath lab just instantly, on a Saturday even.
I would recommend this hospital to anybody. They were right there telling me, everything's fine. They, everything was professional. They took care of everything. Down in the cath lab, they talked to me the whole time I was down there.
We treat everybody like our family, and we want to be the best. We want to be here for our community.
We had friends and family that were in town, and they were always real accommodating and real helpful that way, and just real friendly, and a pleasure to be around.
So they had another guy that was actually gonna do the procedure, but even that guy with a broken foot came in introduced himself, joked around with me for a good 10-15 minutes, telling me why he couldn't do the procedure and who is gonna do the procedure, and stayed with me the entire time until that doctor showed up.
That's what partners are for. We help each other out, and we cover the patient until we can hand off the baton.
They always told me what they were going to do, and that, you know, everything was going to be okay, and, you know, and let me know. And my husband, they let him out in the waiting room. He knew exactly what was going on, and went up to my room. The nurses are just wonderful. I wouldn't, you know, I would not go anywhere else but here.
They look to me as to how I treat patients, and that is the standard for them, and that's how they've always been. Plus, you know, the director of the cath lab, the director of the ICU, Cindy, is always on top of, you know, it's patients first and it's us second. And I think that has rubbed off on me as well as the staff.
Just going in the rooms intermittently to talk to the patients to make sure they don't have any questions about the procedure or what will happen to them after, how they get through cardiac rehab. If they're a diabetic patient, they offer the services of our diabetic center. So those two people come down and talk to them. The staff really take it as a one-on-one opportunity to be very thorough and ask questions and answer questions for the patients and the families.
That's the one thing that sticks in my brain that says, you know what, I think I want to stay in Lawrence because the people here really want to support their hospital. This is a team effort. It's a team effort from nurses, doctors, team effort from office staff, doctors, nurses. It's a team effort with the community, endowment association. This is our hospital, and it's only as good as whatever we put into it.
So we work with these patients in their recovery and help them understand the disease process, understand abnormal symptoms to report to their physician, understand their medications, and understand their risk factors.
Cardiac rehab does a wonderful job about following up with the patients, getting them their strength back so they can get back to work sooner.
The fear, the anxiety, the unknown, the pain, that they're not feeling well, all that kind of changes.
Cardiac rehab and the cardiac department in this hospital is just wonderful. I would recommend anybody that has any slight problem that they think they should come see them and let them take care of them.
You come in with a cardiovascular issue, and behind the scenes, cardiac rehab is already working in order to get that patient enrolled and get that patient to come to cardiac rehab. And it's more than just going and walking on treadmills. Believe me, they do a lot more than just having you go and exercise and look out the windows.
Usually the ones that are the most believers are the ones that were the big skeptics walking in. It's like, I don't want to be here, I don't need to be here, and they're the ones selling the program by the time they're done.
So it's kind of the whole picture that's important to me from the beginning to the end, getting them through their crisis moment.
You know, left side of my heart was completely blocked, and they saved my life. If I'd let it go, I would have died.
The support that was shown by the community vis-a-vis the Endowment Association, it really stuck in my mind. Man, these people are really serious about supporting their hospital.
I think as the director of the Cardiac and Critical Care Service Line, I would like to thank the community for allowing us to give you great care.